My mother really is my inspiration. She was diagnosed with breast cancer as a young woman. She felt a lump in her breast, went immediately to her doctor, and the surgeon came in and said, "Mrs. Oratz, you need surgery, and you will know if you have cancer when you wake up." So she woke up from the operation and she put her hand across her chest and she felt a very large wad of gauze dressing. And she knew that she'd had a mastectomy and she had cancer. Right. Well, a few weeks after her surgery, I was home from college on vacation and I went with her to the doctor's office for a checkup. She was absolutely terrified and just, scared to death that he was going to tell her the cancer had spread or some bad news. And as we left the office, she turned to me and said, "No matter what kind of doctor you become, just be kind. Just smile. Just reassure your patient that she'll be okay." I think .MD is brilliant. I'm a physician. My role is to take care of patients. I'm also affiliated with a medical school and, of course, have an email address and a website that belongs to the medical school, which is more for academic activities and research and teaching. But in terms of my face to the world as a clinician in practice, I thought, how am I putting together this website and this email address? And I didn't want to really use a .com domain because to me that connotes a business domain. And that's terrific if you're a business, but I'm a medical doctor. I'm not selling shoes. So when I learned about .MD, I thought, wow, this is really terrific. This conveys who we are, that fits with our philosophy of being informative, being accessible, but I think it also brings the message that this is about being a doctor, not about running a business, and not about trying to sell you something. Lots of doctors now and practices are, in fact, setting up websites, and I think they would benefit enormously from using a .md domain as opposed to a .com.